and I welcome you to this evening's presentation on Healing Touch, a relaxing energy therapy. And I am looking forward to sharing one of my passions. And I am the Greenwich Hospital's Integrative Medicine Coordinator. I've been a nurse for over 44 years, and I've been here at Greenwich Hospital for over 15 years. And I also do massage therapy. I teach staff yoga, and the certified healing touch practitioner /I is for the practitioner certification and a instructor. So we have a volunteer program where I train volunteers to work with patients, family, and staff with Healing Touch. And it's been very successful over the last 15 years. And I feel grateful that I'm able to offer this to the staff, patients, and family. So let's begin with bringing ourselves to the present moment. And one of the reasons why I do this is that we've all been coming from our day activities, responsibilities, and now we get to just be present and be able to receive the information and to receive the benefits. And I invite you just to take a pause right now. So get comfortable in your chair and just notice your sitting bones, your place of contact with the feet on the floor. Lift and lengthen the spine, drop the shoulders, relax your face, and just notice how you feel. Notice if you feel rushed or if you feel calm, and all without judgment. We're just noticing. We're noticing any sensations that you might feel in the body, any tingling, any coolness, warmth. And one way to bring our attention to the present moment is with the breath. So I just invite you to receive a few deep conscious breaths. And letting go of any tension on the exhale. Coming into this now moment, the only moment there is. And if thoughts come in, as they do, simply let them pass like a cloud over a landscape. And then bring your attention back to the breath. So that's just a quick 3-breath pause to anchor ourselves in the here and the now. And if you need a little bit more of being in the moment, we can say that the moment you value yourself, the whole world values you. So we're going to be talking a lot about self-care and how do we, value ourselves and value our time and what works for you. Everybody has different ways of taking care of themselves, and I'm going to give you a few tools. And one is Healing Touch, and it is a self-care modality, so you can actually do some of the techniques on yourself, and we'll do that at the end. So let me just say that the power of kindness is getting a lot of attention these days, and there's research being done on how this affects our cognition, our body physiologically. It secretes transmitters in the brain, serotonin and oxytocin. And we actually can develop this muscle to help us to be kind. And so I like to begin with being kind to ourselves and being grateful, because the research is also showing that when we're kind and we're grateful, this has a spiral effect on not only the person that's doing it, but also the receiver and also anybody that's watching. So just keep that in mind as we move forward with our show today. And also, I want to just bring up how animals know how to be present. They know how to be kind for the most part, right? Sometimes they're not. But just allowing yourself to just see how animals can just be present right here, right now. And also, this is about Sedona, Arizona, where I was able to experience these red rocks, which is very grounding. And that's something else that we talk about in Healing Touch, is about being centered and grounded. So just remember this photo of these earths that are nice and stable and strong and grounded. So some words of wisdom. Loving yourself makes you feel good. It is impossible to really love yourself unless you have self-approval and self-acceptance. And this is by Louise Hay, and she's the author of You Can Heal Your Life. This is an excellent book for restructuring one's life and finding self-esteem and self-love. And isn't that what we're really looking for, is to feel good about ourselves, to love ourselves, and to love one another. And this is from Bernie Siegel. He's written many books. One is The Love, Medicine, and Miracles. So what is Healing Touch? Healing Touch is a relaxing and heart-centered nurturing energy therapy. You may have heard of Reiki, which is another type of energy therapy. Healing Touch works with the specific symptoms of a patient to set the goals and to come up with a plan to meet those goals. So what else can I tell you? It uses gentle touch to assist in balancing physical, mental, emotional, and spiritual well-being. So it's a holistic approach to healing. And we can't forget that we have a mind-body connection, and that all of these parts of us affect our total being. So our physical well-being affects our mental, our emotional, and then connecting to something greater than you or I, however that you see that. So Healing Touch works with your energy field. You may have heard of the energy field, which is basically the space that's around you, and it can expand for 2 feet, 3 feet, or even larger distances. And it supports your natural ability to heal. And that's the beauty of it. We are not doing the healing as facilitators. We are allowing an energy from the universe, source, however you see that, to work through the practitioner. It is safe for all ages, and it works in harmony with and is complementary to standard medical care. So I mentioned that we work with staff. So there's a lot of stress going on, and staff are able to receive some Healing Touch. Family members are feeling stressed when their loved one is in the hospital. So we get to support them with maybe some fatigue, anxiety, just helping them to calm. So it really is a wonderful therapy. So one of the other things about Healing Touch, I mentioned that it's heart-centered. So we're going to talk about listening to our heart, listening to that place inside that has the wisdom. And this is a picture of 2 of our Healing Touch volunteers. And looking at how we connect with either touching lightly, or we also work above the body. We can work with what's called intention. If someone like has a burn, we wouldn't touch their body, we would work above their body, and it still can have an effect because it's working through our electromagnetic energy of our hands, and that comes through the hands with intention. So what are some of the benefits of healing touch? So reducing stress, calming anxiety and depression, decreasing pain, strengthens the immune system. This is good for cancer patients who are receiving treatment, and also it can help with boosting their immune system. And enhancing recovery from surgery. So we see a lot of patients who have had surgery, and this helps to release energetically the toxins from the anesthesia and any medication. So it helps it to get excreted from the body. And it, as I mentioned, it supports cancer care. And it creates a sense of well-being. So even if you don't have any symptoms, it elicits the relaxation response, which helps our nervous system, which if you're aware that there's two parts of the autonomic nervous system. One is the parasympathetic, which is the rest and digest, and then the sympathetic, which is the fight, flight, or freeze. So with healing touch, it helps with getting ourselves in a more relaxed state of mind with our parasympathetic nervous system. So you can just feel good having a healing touch session. It eases acute and chronic conditions. So if there's symptoms that someone might be having from flu or a heart condition, it can help lessen the symptoms. And it can deepen your spiritual connection. And this is really important now in today's world that we're living in, to have something greater than ourselves that we can call upon when sometimes it's been, feeling hope, not having a lot of hope. So this helps us to have that extra connection. And we'll talk more about that. So what is the history of healing touch? Janet Menken is no longer with us, but she was a registered nurse and a certified healing touch practitioner and instructor. And she founded Healing Touch back in 1989 in collaboration with the American Holistic Nurses Association. She also worked with other healers to come up with different techniques to bring it into a curriculum. So here are the other healers: Alice Bailey, Rosalind Briere, Dr. Brute Joy, Barbara Brennan, the Hopi Indians. And this was also based on her study of nursing practice. So it's a standardized curriculum, was developed as a continuing education program for nurses, massage therapists, physicians, allied health professionals, and anyone interested in learning healing touch. She actually wanted it to be in every household so that you can, work with your loved ones, because it's an easy technique to learn and to practice. So this Healing Touch is credentialed for certification as a practitioner and instructor, and that was established by the American Holistic Nurses Association in 1993. And then the certificate program was received by Healing Touch International, which is the parent name of Healing Beyond Borders, in 1996. And then the AHNA has endorsed this program in 1997. So I mentioned Healing Beyond Borders, educating and certifying the Healing Touch. It's a nonprofit professional membership organization, provides Healing Touch education, certifies practitioners and instructors. We have a code of ethics and standards of practice, which is taught all over the world, and it's basically the same across the world. Supports Healing Touch research and the use of Healing Touch with integrative healthcare. promotes the work of Healing Touch around the world, as I mentioned. So here we are, we get to pause one more time, taking in a moment to be, just to be with yourself, letting in this knowledge, and then we get to go again, just practicing being present. So now we're going to be open for a little bit of the research. Complementary and alternative medicine, CAM, therapies and integrative therapies continue to grow in the United States. A lot of people are looking to have complementary to traditional medical care to help in their becoming more balanced with their therapies. So there's around 1 million adults use a biofield therapy in 2007, and conventional healthcare relies on evidence-based medicine and practice. So the evidence refers to research results that are published in peer-reviewed journals. So we're going to talk a little bit about the biofield research with cancer. Healing Touch has been shown to improve disease and treatment related symptoms experienced by those with a diagnosis of cancer, specifically with managing their pain. And among patients with cancer who explore complementary modalities, biofield therapies such as Healing Touch are rated as providing the highest level of benefit, symptom management, and improving the quality of life, which is really important with cancer patients. Healing Touch appears to improve markers related to immune function in patients with cancer. And more research is needed to examine the effects of Healing Touch on other cancer-related symptoms, including fatigue and quality of life. And now we'll talk about the biofield therapies and cardiovascular disease. Healing Touch has been shown to decrease the length of stay associated with coronary heart surgery significantly. Healing Touch improves measures of well-being and quality of life in patients with cardiovascular disease. And the biofield therapies have a positive impact on physiological measures related to cardiovascular disease, including heart rate and hematocrit levels. And now biofield therapies and pain management. Healing Touch has been shown to improve pain significantly in a variety of patient populations. Healing Touch is frequently used to effectively manage pain experienced by patients with cancer. And other factors related to the subjective nature of the pain experience can have an influence on the efficacy of biofield therapies to reduce pain. So here we take in the beauty of the sunflower, taking that mindful pause, consciously breathing in and breathing out. So there's a framework for a Healing Touch session. It is actually called a nursing process, and it is a medical model. And that's one of the reasons why we chose to have it at Greenwich Hospital, because it is a medical model and it fits in nicely with traditional medical care. So our practitioners will do with a regular patient, not one at the hospital, but someone who would come to see you or the practitioner, that we would do an intake or an update if they've coming for the second time. And then there's always a practitioner preparation. So I mentioned before about centering and grounding, and we'll talk about that shortly. But there's a preparation that the practitioner needs to do to be in right relationship with the patient, because it's an honor to come into someone's energy field. So there's a pre-treatment energetic assessment. And what I like to say is that our hands, I call them energy stethoscopes. So we use our hands to do a hand scan to check in any imbalances or disturbances in that energy that's around the body. And so we can detect that and look to find ways to bring that into harmony and balance through the whole energetic system. And then we'll come up with a problem identification. So whether it's anxiety or pain or fatigue, or again, just relaxation, or whatever the problem may be. Maybe someone is grieving a loss. We work well with grief and letting go of the pain from grief, and also with transition. People who are transitioning, and I can be in palliative care, this can be very comforting and relaxing for the patient and the family member. And then we come up with a mutual goal and a plan. How are we going to reduce or promote a well-being or reduce pain or anxiety? And then there's many different interventions that we can offer to the patient. And then we always do a post-treatment energetic assessment to see if there's been any shifts in what the treatment was, and whether the person fell asleep, which very often happens because, again, we're eliciting the relaxation response and patients go into a deep state of relaxation. And then at the end, we're going to ground the client or patient by holding their feet or their shoulders, and then we're going to release energetically with intention out of their field so that we let their energy field be whole and complete, and then I come back to my energy field, which is whole and complete. And then we check in and we see how the patient responded. And there might be some homework. We might offer a book or a meditation app, or maybe we might have a referral for someone to go see a massage therapist or acupuncture, or whatever the need is of the patient. So that is the framework of a healing touch session. And as I mentioned, it is the nursing process. So I talked about the healer preparation, and we're going to talk about centering. So centering, we can do that. You don't have to be doing healing touch. You can just practice coming to your center. So however you do that, you probably already know. And one way is with our breath. So we come to breath awareness like we did at the beginning. We inhale calm energy and exhale tension or stress. So just by doing that, that helps us to come into our body, to drop down from the mind, from the busy mind, and coming into this now moment. And it helps us to slow down and become relaxed and focused. And I do this quite often in my day to stay focused, because if I have, several deadlines, the phone's ringing, someone's at my door, I can get off subject, I can get out of focus. So I just come to my breath, I take a pause, and I am able to come back to my center. And then to ground, I mentioned about grounding, thinking about that mountain peak or the mountain in the rocks deep into the core of the earth, because the earth gives us sustenance, it gives us stability, it helps us to feel safe. So I like to go to the beach and earth, take off my sandals and be in the sand and the water, and that helps me. So maybe you can think of something that works for you. And then, of course, we're going to set the intention. We're going to set it for the highest good of the patient or the client. So whatever is going to happen is going to be for their highest good, not particularly what I have in mind. It's what's best for the patient or the client. I'm going to be open to receive, to be a clear channel or facilitator for healing energy and light. As I mentioned, it will come stream through me and be received by the person that I'm working on. And then we're setting the intention to restore harmony and balance, which I mentioned earlier. And attuning is actually coming into energetically connecting to the client. And we can do it energetically by just having that kind of rapport with someone, or we can touch them lightly on the shoulders or the feet. So that's attuning, setting your intention, and centering and grounding. And here is another photo of the red rocks, of being in this safe sturdy, strong place. When I went there, my sons actually climbed up to the very top of this, which didn't leave me feeling very safe for them, but they managed okay and came back safely. So I was grateful. But anyway, here we are getting centered and grounded and using that as a tool for ourselves. And that's wonderful that we can practice that for ourselves. And here's another photo. Just breathing in that strong sense that's in us, that circulates throughout our body, the energy that's all around us all the time. So we call this the human energy system. It's measurable in all living things, including plants and animals. And James Oschman, PhD, in his book, Energy Medicine, the Scientific Basis, states, in a few decades, scientists have gone from a conviction that there's no such thing as energy fields in and around the human body to an absolute certainty that they exist. And then John Zimmerman, MD of the University of Colorado School of Medicine, he coined this superconducting quantum interference device, which is called SQUID. And it's measured the bioelectromagnetic field of an energy practitioner's hands. So trained practitioners' hands had the frequency range of 3 to 30 hertz with an average activity in the 7 to 8 hertz, which is actually the same as our Earth, 7 to 8 hertz. So it's interesting that they were able to measure this in the practitioner's hands. And this actually supports nerve regeneration and bone growth and soft tissue repair. It's also measured energy field that surrounds and expands beyond our body. So we're going to talk a little bit about energy centers or chakras. I don't know if you've ever heard of those, but they're these energy centers that take in information and help us to assimilate it in our body and help us to regulate our energy with our organ systems and glands. So it's a complex network of energy. And then I've talked about the biofield, the energy field, or the aura. You might have heard of any of these three names. So this Eastern philosophy supports that there are 7 major chakras or energy centers located along the spinal column. And each correlates with an endocrine and nervous system and specific organs, as I mentioned. Healing touch techniques open, balance, and energetically connect these chakras so that they are communicating with each other and assist with healing on the physical, emotional, mental, and spiritual levels. So this is a psychic picture of the energy system. The chakras all resonate with a certain vibration, a certain frequency, and a color, because all colors have a certain vibration. So the root at the base of the spine is red. It doesn't look as so much red there, but it is red. And then the sacral is above, near the belly button, below the belly button is orange. And then right where the midline of the stomach is yellow. That's our mental layer. And then the heart is green. The throat is blue. And then the brow between the third eye is indigo. And then the top is violet. And then it turns into white light going up at the top. So this is the energy field around the body. And then I have one more picture of the spiritual energy system as this energy is moving down from above and up from below. And it circulates all around the body, inside and around the body. And there's, I don't know if you've ever heard of meridians, but that works with acupuncture. And there are 12 meridians going north to south in our body. And then there's central couple central channels, one in the middle and one on the left and the right. So with Healing Touch, we work mostly with the chakras, but we do address the meridians as well. So I talked a lot about Healing Touch as being a self-care tool. So what does self-care mean? It means taking care of yourself first so that your cup can be full. Daily practice of being in quiet and still place within, so that we can actually, check in and see what is it actually that I need in any given moment. And it's something that I am conscious of as often as possible when I start to feel that I'm off in any way. So I can always have these tools. Living in right relationship with myself helps me to be in right relationship with others and our environment. So when we're taking good care of ourselves, we want to take good care of our planet. And then having that spiritual connection with something greater than ourselves. Taking care and supporting the physical body, the mental functions, honoring our emotions, and being on a spiritual journey. And then practicing a self-chakra connection. So towards the end, I am going to teach you a self-chakra connection. So we're going to get to practice that. And that is something that you can do on a daily basis to keep you in right relationship with your physical, mental, emotional, and spiritual bodies. So what can you do to be whole and complete? So we already are whole and complete. We just have to remember that. And there's many different ways that we can take care of ourselves. So physically, what can we do? So we all know that exercise is paramount. So moving, it gets the endorphins going, any kind of body work, staying hydrated, eating nourishing food, which helps to keep us thinking straight and clear and focused. Taking a bath, sleep. I want to underscore sleep, because I know for myself, if I'm worrying about something big that's happening in my life, that I might wake up in the middle of the night. And so I get to practice what I preach. And sometimes is better than other times, but it's really good to get into a routine in the evening, like slowing down, maybe doing some gentle exercise, gentle yoga postures, having some kind of ritual, maybe journaling. They're showing how important writing 3 things that are important to you, that you're grateful for in the morning and at night, that's actually has science behind it, and that after 21 days we can create a new habit. So doing this on a regular basis is really good for us. So emotional, what can you do to help you to stay balanced emotionally? Being in tune with what you feel, like asking yourself, how do I feel right now? And honoring it really is important in today's day. Really noticing that it's important to honor and not deny what we feel. Talking with a friend, a trusted friend. When we do that, we're sharing how we feel, and the other person is listening, and it actually secretes oxytocin, because that's our bonding hormone. So it's good for both of us, to the one that's receiving, listening to the friend, and the one who's talking. And then letting go with a good cry. Nothing like having that to feel better and have hope. Painting, having that attitude of gratitude that I mentioned. And then mental. We all know and hear every day how important having that quiet time, that quiet meditation practice, that mindful awareness of what we're doing and how we're doing. I've already mentioned the journaling, gardening, walking, all of these parts of ourself affect each other. So physical can affect our emotional and mental being. and then including our spiritual, appreciating nature. That was something during the pandemic that I tried to do, even though, we were on lockdown. I still went outside and appreciated the spring and the beauty around me, the grass, the flowers, the trees, just finding that sense of appreciation really helped me have hope for the future. And then if we have a specific religion or spiritual practice, that can also strengthen us spiritually, singing, dancing, prayer. So you can probably come up with a couple on your own, what works for you. And so, write down what works for you and see if you can keep incorporating it into your life. Step out of the circle of time and into the circle of love by Rumi. So really finding this space within. This is from Peaceful Mind, Peaceful Life, and peace is really our natural birthright. So I try to breathe in peace, breathe out peace. That's another mantra that I use. And here's something in nature that brings me joy is seeing the colors of the rainbow. I am peace. And it can be a great mantra to repeat to ourselves. And, when you're feeling stressed, you can just say, let me just breathe in and breathe out that I am peace. So I wanted to introduce you to my feline friend, Chibi, who's no longer with us, but she loved to practice yoga with me, and cats seem to know how to take good care of themselves. So I miss her, but she was a great love. So we are going to have some time now to have a self chakra connection. And I'm going to guide us through, and it'll take about maybe 10 or 15 minutes. So we have some time, and then we'll have a question and answer in the Q&A that I'll be happy to answer any questions that you have. So what I'd like to do is have you check in with yourself and just see what it is that you would like to, how you'd like to feel at the end of this session. And also check in if you're feeling stressed at all. So on a scale of 0 to 10, or if you're feeling anxious or anything that you're feeling a little off, on a scale of 0 to 10, stress, pain, or anxiety, pick one or two and just see where it is that you are on a scale of 0 to 10. And so I'm going to just voice guide us through this technique of the self chakra connection. And what we're going to do is I'm just going to tell you, we're going to begin by opening up the feet chakra, and then I'll guide you through the lightly touching the ankle and the knee, and then the knee and the hip on the right leg, and then we'll do the left leg. And then we're going to do the root chakra, which it will use our hand right above the knees, and then placing the hand on the sacral, which is right below the belly button, and then the sacral to the solar plexus, which is below the sternum. And then the spleen is on the left side, and we'll to place the hand on the solar plexus as well. And then we'll go to the solar plexus and the heart, and then the heart and the thymus, which is where our immune system is. And then once we come to the thymus, we'll come to the hands, the wrists, the elbows, the shoulders, giving ourselves a hug. Then we'll come back to the thymus, throat and brow and crown, and then crown, and then the hand goes up towards the sky to what's called the transpersonal point, which connects us to all that there is. All right, so it's quite simple, and it's something for you to just allow yourself to be and notice yourself breathing in and out. And we'll stay for, probably 10 or 15 seconds. Normally we stay for 30 seconds to a minute, but because of this way that we're doing this, we won't stay that long. So I just want to give you a sense of what it's like to give yourself this self chakra connection. So find that comfortable position in your chair. And if your feet are without shoes, you can use your hands, or you can use intention that you're touching the top of the foot and the sole of the foot. So just holding the right sole of the foot and the top of the foot. And all you need to do is notice yourself breathing. And we're just going to set the intention that we're opening up the foot, so that if there's anything that you would like to let go of, you can let go of through these open channels in the feet. So we just set that intention, and then move the lower hand to the ankle and the top of the foot, and the upper hand to the knee. And if you're comfortable, to close your eyes, so that hopefully you're in a position that you're in a safe place with no disturbances around you, so that it's quiet, and that you can just receive this sensation that you might feel under the palms of your hands. You might feel some tingling. You might notice some warmth. And you're noticing yourself breathing. I'm breathing in and I'm breathing out. And all along, you can imagine that this is how you're taking good care of yourself today. You're allowing your nervous system to relax and just to be with yourself. And then gently moving your hand to the knee and the right hip. So now we're connecting the whole right leg. And just see what that feels like, to feel the whole leg connecting, opening, and balancing. And you can imagine that you're breathing in unconditional love. Because as I mentioned, this is heart-centered work. So we always come to our heart center and we breathe in compassion for ourselves. So we're breathing in kindness for ourselves. As you allow the energy to just flow in and out with the breath. And when you're ready, you can lower that leg and lift the other leg if that feels comfortable for you, placing the hand on the sole and the top of the foot. So here we are now opening up the left foot chakra, this energy center in the sole of the foot. So just connecting again to what feels good in this moment, breathing in and breathing out. Noticing any sensations of the body, where your hands are, or anywhere in the body. Just noticing it brings us into the body, brings us to how we feel. Bringing the upper hand to the knee and the lower hand to the top of the foot and ankle. So we're now connecting the lower half of the body And again, we're breathing in this unconditional love for ourselves. Noticing the breath as the anchor, softening the body, and perhaps letting go of any tension on the exhale. Moving the lower hand to the knee and the upper hand goes to the hip. So now we're connecting the whole leg. And you might notice a difference between the right side of the body and the left side of the body. One side might feel warmer than the other side. You might feel a difference in the flow. And all of this is without judging. We're just noticing. Noticing the breath flowing in. Perhaps the belly is rising on the inhale, and the navel is going back towards the spine on the exhale. Keeping the hand on the left hip, bring the other hand to the other hip. So now we're connecting both hips. Both hips. And the legs connect us to the earth. That red-orange color like the rocks that we saw. The grounding of the earth. So our legs connect us to the earth. And then bringing the lower hand right above the knee with the palm facing the root chakra, which is at the base of the spine. And then the other hand goes to below the navel, the sacral. And this is the area for our emotions. So we breathe in and breathe out into our emotions. Connect to our female and male reproductive organs. So we connect to the physical body. Breathing in orange, breathing out orange. Just feeling that unconditional love for yourself. And then bring the lower hand to the sacral, and then the upper hand goes to that solar plexus, which is that mental, it's our mental capacity, our personal power below the sternum, where the rib cage connects to the breastbone. So here we are connecting to the lower physical energy centers that connects us to our physical, emotional, and our mental. So breathing in and breathing out. So we want to allow these energies to flow up into our bodies so that we can let them have flow and not block them in our belly. So we're breathing in and breathing out, this unconditional love. And then slide the left hand to the left side underneath the rib cage, which is the spleen. And then the other hand is on the solar plexus. So the spleen is considered a spiritual organ, and it helps when there's an emergency. We need extra blood to go to a particular area of the body. So just rest in the upper abdomen and breathe in. And the organ is the into the spleen and into the stomach, breathing into the liver on the other side, all the organs in the upper abdomen, breathing in and breathing out, organs of digestion, assimilation. And then bring the hand that's on the left spleen to the solar plexus, and then the other hand comes to the heart. So here we are, bringing those energies from the lower physical chakras up into our heart, which is the green color. So I invite you to breathe in green, breathe out green. And this is the center for our compassion and all the attributes of the heart, which is harmony, healing presence, unconditional love, compassion, kindness, and selfless service. So just breathe in those attributes of our heart, feeling that connection to ourself, to that deeper part of ourselves where the wisdom lies. The heart is very intelligent. It has the largest electromagnetic field. So breathing in all of those attributes of our heart, breathing out green, breathing in green, and then moving the hand on the lower hand to the heart, and then right above is the thymus gland. So really important to keep our immune system strong. Just feel that green color radiating up into the thymus. Feeling that unconditional love spreading throughout the cells of your body. You can just feel this self-love and self-care for yourself. Noticing any sensations in the body as we continue to release the hands gently. And now we connect a circle of love by holding on to our wrists, and you can just relax your arms in your lap. Just feeling that whole circle of care for yourself. And then holding the elbows. And the shoulders. So we give ourselves a hug. Coming back to the thymus and then the throat. So the throat is our center for speaking our truth, being our authentic self, and it's the color sky blue. So just imagine the beautiful blue sky, breathing in and out, feeling any sensations of warmth or tingling or any vibrations, speaking our truth, allowing the energies of all the center for our body, our emotions, our mental capacity up into the heart, all the way up into the throat. Breathing in, sky blue, breathing out, sky blue. And then moving from the throat to the brow, which is between the third eye, which is the indigo color, the color of the night sky. Breathing in and breathing out. And this connects us to our pituitary gland, and the master glands, keeps us in balance with our hormones. And then we move from the brow to the crown, which is violet. So we open up this 1,000-petal lotus flower on the top of our head. And it goes from violet to white light. And then we place the hand on the crown, and then the palm faces up towards source, however you see that, into white light. So just receiving this golden light that you see if you have your eyes open for the screen, and you can just allow your hands to come rest on your lap. And imagine now that there's this beautiful rainbow of colors that are coming up from the earth, feeling that earth energy, that red and orange colors coming up to come up into yellow, green, blue, indigo, violet, white, and it streams up and out like a cascade of a rainbow of colors down and around your whole being, so that around your biofield, it's clear, it's balanced, it's energized. And all of that energy and loving energy goes into the cells of your body so that you can feel a sense of being calm, connected, and balanced. So you want to just take another moment to allow yourself to integrate and just notice how you feel. Notice if there's any shift in how you feel from how you felt when we first started. Just checking in with yourself, integrating back to this now moment. Maybe a little refreshed. And I invite you to feel your body sitting in the chair like we began. Feel your feet on the floor. And just notice if you're feeling any different when you checked in with yourself to ask whether you had any stress, any pain, anxiety, and notice what your number was from a scale of 0 to 10. And then check to see if you have a shift. Did it reduce? Is it the same? Hopefully it didn't get any worse. So I invite you to receive a full breath in and a long breath out. Perhaps a sigh, letting go of any tension on the exhale. So I am open to receive any questions or comments that anybody would like to put in the Q&A. We have a few minutes left. Happy to respond. And or maybe even just say how you feel. If that was helpful, if you learned anything, if you think you're going to practice. And I wanted to also leave you with Dr. Brene Brown, some 10 guideposts for wholehearted living. Really important. They're really self-explanatory, but I leave this with you to have a lightness of being, maybe some laughter, play, rest, joy. It really is why we're here, to build resilience and to practice taking really good care of ourselves. So anybody have any questions? Here are, if anybody wants to take a picture of the resources. Let's see. You're most welcome. It's my pleasure, Ebba. So just have about 1 more minute. Anybody else want to share anything? Oh, thank you so much, Ruth. I'm glad that you're here and that your world is a little bit rosier now. That is really good to hear. And I hope that everyone has a restful sleep, and this will be recorded. It is recorded, and it will be on the Greenwich Hospital website at some point. It does take some time. Thank you, Sandra. Nice to see you. Nice to see your name. Nice to have you here. So I'm going to, unless there's something else, it's want to get you out on time so you can go enjoy the rest of this beautiful day. And I hope you have a wonderful evening. Thank you. Good night.